Here's Judge Clay Jenkins. Let's listen in.
Authority of the Texas Government Code, the Dallas County Judge orders as follows. Pick this up so I can look at you while I'm talking. Effective as of 11:59 p.m. on Monday, March 16, and continuing until 11 a.m. on March 20th. And let me stop for a second and explain to you. We will seek to have that extended, but we're working under the past authority, and so that will be extended. Public and private community gatherings, as defined below, are prohibited anywhere in Dallas County. And that is essentially, I'll read that so there's no misunderstanding in full. Second, restaurants with or without drive-in or drive-through service, and microbreweries, microdistilleries, or wineries may only provide takeout, delivery, or drive-through service as allowed by law. Bars, lounges, taverns, or arcades and private clubs shall close. In addition, the Office of the Dallas County Judge and the Dallas County Health and Human Services Department strongly urge organizations that serve high-risk populations to cancel all gatherings until further notice. These recommendations are based on the social distancing practices attached to the order, as well as the implementation of mitigation strategies for communities with local COVID transmission. For purposes of this order, a community gathering is any indoor or outdoor event or convening, subject to the exceptions and clarifications below, that brings together or is likely to bring together 50 or more persons at the same time in a single room or other single confined or enclosed space, such as an auditorium, theater, stadium, indoor or outdoor, arena or event center, gym, meeting hall, conference center, large cafeteria, or any other confined indoor or outdoor space. An outdoor community gathering under this order is limited to events in confined outdoor spaces, which means an outdoor space that is enclosed by a fence, physical barrier, or other structure, and where people are present and are within 6 feet of one another for extended periods. So let me stop for a second and say that does not mean you can't go outside and take a walk or go to the park. For purposes of clarity of community gathering, that does not include the following, so long as visitors are generally not within 6 feet of one another for extended periods of time. Bus terminals, airports, office space, schools, residential buildings, grocery stores, shopping malls, or other retail establishments, not including restaurants with or without drive-in or drive-through service, microbreweries, microdistilleries or wineries, bars, lounges, or taverns and private clubs, where large numbers of people are present, but it is unusual for them to be within 6 feet of one another for extended periods, and hospitals and medical facilities, In all such settings, the Office of the Dallas County Judge and the Health Authority recommends following social distancing recommendations and personal hygiene measures such as hand sanitizer and tissues should be provided whenever possible. If someone in a household has tested positive for coronavirus, the household is ordered to isolate at home. Members of the household cannot go to work, school, or any other community function. Nursing homes, retirement centers, and long-term care facilities are instructed to prohibit non-essential visitors from accessing their facilities unless to provide critical assistance or end-of-life visitation. Public and private school and institutions of higher education are instructed to provide a safety plan to the Dallas County Office of Homeland Security and Emergency Management before students return to classroom settings. And that is to be done at least 72 hours before students are to return to a classroom setting. Additionally, the Office of the Dallas County Judge and the Health Authority instructs all employees to remain at home if, let me say this part is not an order, but I'm strongly encouraging you, if you're sick, stay home. Employees for private businesses and nonprofits with 6 or more employees in the city of Dallas can use their paid sick leave when they are sick or to care for sick family members pursuant to a law that was passed last year, and I just remind people of that. This order will be posted conspicuously, and you will get a copy. And I would ask staff, because I don't see the time for the schools on here, to amend that or to show on the order that the press gets the 72 hours that people before school is back, the one that you give them. With that, I've got a couple of things I want to say, and I'm going to turn it over to Phil. I know these are uncertain times for our community, but there is some good news, all right? Today, we opened drive-through testing for first responders, health workers, and Parkland patients at a facility at Parkland. And in the coming days, we will open 2 large testing facilities, one in Grand Prairie at the former Verizon Theater, and one in at the American Airlines Center in a parking garage that will allow for drive-through. We will get more information on that in the coming days, and there'll be an announcement about that. But I think it's important that you know good things are happening too. With those 2 new facilities that will open, those will be a joint operation with the county and the city and the federal partners, and that will be led by our county hospital, Parkland Hospital, along with Dr. Phil Huang. And so that will allow us to test up to 5,000 people a week when we get those open, and the feds send down the equipment for that. So that's good news. Another piece of good news that I want to remind people is our first 2 patients went home well. Okay, getting the coronavirus is a bad thing, but it's not necessarily lead to long-term impairment or death in every person. The fact that it has a higher than the flu by a long shot mortality rate in many populations, and the fact that it spreads so easily has us working to keep that from happening in our community. But most people who get this disease will recover from it. So we had 5 cases today. One of those cases is our second confirmed case of community spread. Community spread means that there's no travel explanation of them getting it somewhere else. There are many things that have happened over the last 48 hours that have led to changes and tightening of restrictions, and I want to remind people who watched President Trump's press conference of what my friend Dr. Anthony Fauci said. Dr. Fauci said that if you are looking at the data for today, you're always 5 days behind. So what we're trying to do here, I just want y'all to understand this, we're trying to be like Lodi, Italy, that was aggressive on the front end, and that as a result, hundreds of if not thousands less cases than the town down the road that waited for over a week to act. And that's what we're trying to do, is get ahead of this. But there's a challenge that we have, and so I want to speak about that challenge. The reason for the bars closing, if you look at what the White House put out today, what President Trump said, and this is a direct quote from what President Trump's release said, in states with evidence of community transmission, which we have, bars, restaurants, food courts, gyms, and other indoor and outdoor venues where groups of people congregate should be closed. This is in a message to governors of those states. Here's our challenge, and I've talked to the state privately about this. I'm going to talk to the public about it now. If Dallas County acts aggressively, but people have cars and we all live, there's 2.7 million people in Dallas County. There's 7.6 million people in the Metroplex. If all this accomplishes is that the bars in Dallas County close, and there's 3 times as many people in the bars in the surrounding counties, and then all those people get on our roads to take a longer drive home, we haven't done much to keep our community safe. We've done all that we can, and this government will do all that we can to keep you safe. But we need our governor and our regional partners to come together, and we need to. The only way really to do that is through the state. We need the state to come in and lay out some parameters on that, and I hope that they will. It's important also to remember why Dallas. There's two big reasons why Dallas County is different from the surrounding counties, but we all are in this together. So even though there's not community spread in our other big counties, and even though there may not be a case yet in some of our smaller counties in the Metroplex, we're all in this together. But the fact that we have community spread in not one but two places here in Dallas County that's just been documented on the small amount of testing capability that we've had, which is more than the rest of the state, but relatively small to the 5,000 a week we're about to have, tells you that we have community spread and we have to act. But we need our neighbors alongside us, and so we need the governor to lead on that. And I appreciate the great work he's doing, but for these prohibitions to work, they can't be where somebody can drive a half a mile and congregate in large groups. Second, I want to remind you about this about Dallas County. In Dallas County, our population looks different on a health basis than some of the surrounding counties. And if we're one of I think 13 states that are left that have not taken Medicaid expansion, which is what would provide insurance coverage to people who cannot afford, who work but cannot afford insurance. That would ensure or provide coverage for 250,000 people here in Dallas County. That means 250,000 of the people that this could spread to don't have access to a primary care physician. That makes our job here much, much harder, and it makes us behind 37 states that have that. And so we must act aggressively to be able to have a chance to stem the tide of this. Let's see. Finally, before I turn it over to Phil, I want to remind everybody that government can only do so much, particularly in a situation like this, because really it gets down to personal responsibility. There's no way that I can legislate or anyone can legislate for you personal responsibility and looking out for not just yourself but the community. But did you notice today from the National Institute of Health, they didn't say 50, they said 10. They said avoid groups of 10 or more in a social gathering. We need people to not just look at what we're doing in these orders, but look at these guidelines and follow these guidelines. What we've got to do as a community is we've got to turn our fear in this community to faith. Faith in a higher power, but also faith in the science. These guidelines are the science. You need to have faith in those guidelines, and you need to follow that. Secondarily, we've got to turn from selfishness to sacrifice, all right? And by that, what I mean is you may feel like it's all right for you to get together with your friends, but the life that you save may be your Nana's or your friend's Nana if you will just stay at home for a time. We just need to stay at home for a time. We need to hunker down, and we need to get through this. We've got to move away from panic. People do not make good decisions when they're panicked. We got to move to prayer and personal responsibility. And I know you can do this, North Texas, because every challenge hits North Texas. They rise above that challenge, and together they defeat that challenge. But we're all in this together, and we cannot do it as government, and we cannot do it as first responders and health and the health community. The health system will be completely overrun if you do not act with personal responsibility. And with that, I will turn it over to Dr. Phil Huang.
Thank you, Judge. And these orders are really to enhance, we've been in, a containment mode, but moving to that mitigation and social distancing. And so the social distancing, just understand that, what we consider a close contact or significant contact is when someone is within 6 feet of someone who has the infection and for a prolonged period of time. It's not just passing by in a, store or something in a hall, but it is prolonged period, something like being a caregiver, or also actually, though, being in a waiting room in a hospital setting or in a healthcare setting. But also, or it could be exposure to the droplets, like if someone does cough or sneeze on someone. But that's what the actual close contact and significant contact would be. And these social distancing measures are to prevent that, and to prevent that sort of contact that can result in infection. And so some of the things that are in the order, we define the vulnerable populations that are who we're really trying to protect in particular with these. Those persons over 60 years and older, those with certain health conditions like heart disease, lung disease, diabetes, kidney disease, weakened immune systems. And so the recommendations for those populations in particular are really stay home. Don't go to gatherings unless it's absolutely essential. Telecommute if you can, and avoid people who are sick. Also, workplace and business recommendations are in there to minimize exposure, to suspend non-essential employee travel, minimize number of employees working within 6 feet of another, including minimizing or canceling in-person meetings and conferences, urging employees to stay home when they're sick and maximizing flexibility and sick leave benefits. Not requiring a doctor's note for employees who are sick, so that, again, these aren't barriers for people to taking their sick leave. Consider using the telecommuting options. Some people need to be at work to provide essential services of great benefit to the community, but they also can take steps to minimize their risk. Cancel non-essential events, and again, we've seen now the recommendations on the size. Do not attend any events or gatherings if sick, and for events that aren't canceled, having hand washing capabilities, hand sanitizers and tissues available, frequently cleaning high-touch surfaces, countertops and handrails, finding ways to create space and minimize close contact as much as possible. Also, transit, cleaning and protection, increasing cleaning of vehicles and high-touch surface areas, providing hand washing, sanitizers, and tissues in stations and on vehicles. In healthcare settings, avoiding as possible and protecting the vulnerable again. Long-term care facilities should have a COVID-19 plan in place in accordance with CDC or state guidelines, and long-term care facilities should restrict all visitation except for certain compassionate care situations such as end of life. The general public should avoid going to medical settings such as hospitals, nursing homes, long-term care facilities, even if you're not ill. If you are ill, call your health care provider ahead of time, and you may be able to be served by phone. Don't visit emergency rooms unless essential, and follow guidance and directions of all facilities. As the judge mentioned, this is all of our responsibilities to do our part, and that's how we will be able to overcome this. And we will overcome this, but it's going to take all of us together.
Dr. Huang, as the county's head health official, from a national level to here, talking about limited contact with 10 people or more, DART is really big. Being transparent, I take the DART training from the county, but closing bars and all these things, should people take the train to work or take the train places, since that is a long duration of time that you're in?
Those are definitely considered, again, when I defined what is a significant contact, that's what you're trying to avoid. You would certainly want to distance oneself 6 feet away, not be exposed to the droplets from coughing or sneezing, because that's how it's transmitted. And so you're trying to avoid that situation. There is the cleaning of the surfaces and avoiding the contact with those. But also, and I didn't mention, what everyone should also be doing is washing your hands. Don't touch your eyes, nose, and mouth. Cough or sneeze into your sleeve or into a Kleenex and throw it away. Stay home if you're sick. Absolutely home if you're sick, and avoid sick persons or people who are coughing or sneezing.
Should the transit agency be operating?
Again, we've been looking, at the guidelines and are making the recommendations regarding surface cleaning, but
let me touch on that. So we're going back upstairs when we're done with this to keep working and talking to people. Phil and I were on the phone together with doctors at the EOC, the federal EOC up in Washington at midnight last night. And again, we were on the phone with people at 6 o'clock this morning. So we're constantly looking at that. But I think you asked the question, Ken, so think about it this way. We're telling people to essentially shelter in place. How do they get to the grocery store? So there are no easy choices here. But what we believe is that as long as it's possible on your transit to maintain good social distancing, I know DART is working very hard to keep their trains and buses clean. Yes, ma'am.
Barbershops, beauty salons, I know they're asking in social media.
So that is
So close contact.
Yeah, that will be difficult for there to be social distancing there, but we are not prohibiting meetings of 50 or less, and we're not asking people to avoid close contact in 10 or less. What I would say about that is if you don't absolutely need to be around a person, if it's not a critical, situation, if it's, for instance, getting their hair cut, maybe people need to wait on that. Yes, ma'am.
How many people will you be able to test at those two huge testing facilities?
2,500 per site per week.
Are the state regulations and supply going to be able to match that? I mean, I know you've had some issues with those two things so far.
The numbers could change. The numbers did change yesterday from our initial federal call to our late federal call. But the best visibility that I have now, before the feds get the equipment and the Roche kits to us, is what they're saying is 2,500. And we're going to have a joint announcement about that with all the partners and working about that and get you more visibility of that. I point that out tonight because I know the public is hearing this news. They've heard from the president, and I believe Mayor Johnson spoke before we spoke. So they're hearing all of this news, and I want them to hear that there's some good news, as well. And if we all act with personal responsibility, there'll be good news, coming out on the other side of this.
Dr. Huang.
Regulations don't need to change though in order for you to get through those 20.
Sorry.
Do the state regulations on who can get a test need to change though? Because right now they're still talking about people with travel history who've had contact with someone with COVID. And they're still pretty tight.
Well, Nick, I think, okay, so it's probably not a secret at this point that I'm for loosening the restrictions on the testing, but I probably should keep most of those conversations internal, except for to say I have community spread in Dallas County, and so I believe that travel, while I think it's important to take a full history of a patient, I question that. I think the priority that I would like to see set for those, remember that if this gets to be like it has been in other cities and other countries, then we are at a place right now where we are seeing rapid multiplying. And so those tests may be reserved for people over 65 and the health community and first responders. But it's a fast evolving situation, and that's probably the best I can tell you. Testing is one of those things that is so fast evolving and frankly so technically confusing that it's hard for us to answer questions on it.
Dr. Huang, I was going to ask him, how confident can the public be that these changes that are going to cut off income for people, close businesses that may not recover, how confident can they be that this will make a difference?
Well, again, we've seen the experiences from some of the other countries on the West Coast, what's going on, and the judge mentioned the example in Italy where there are two communities where one implemented some of these and almost a couple of weeks later another didn't, and there's a difference like in about 1,000 in the number of cases in those. So, we are trying to, all of these efforts, these are the social distancing efforts that need to occur earlier than later. You can't, as he mentioned, you right where you are, you're 5 days behind at least, and you have to do these earlier than later, and they have been showing this is how we prevent that spread, that sort of exponential increase.
And what are the consequences for those businesses that don't abide by the orders or suggestions?
it will buy a fine and potentially, it could be punished by a jail sentence.
And how much is the fine? I'm sorry.
I believe the fine is $2,500 and the jail sentence is up to 6 months. But I don't think that's, going to be necessary. I think most of our businesses, will comply with that. And, know that if those that do not will run, the risk of a couple of things, right? When we find out about it, they'll be cited. But also, I don't think the public would look on with favor with people who are violating a public health order in a state of emergency. I want to add something to what Phil said in response to JD's question. I'm talking to my counterparts in the places where that are the worst hit places in the United States, and also talking to my counterparts in Washington and the top people in the state on the health side, and so is Dr. Huang. We can't find anyone who says, well, I did something early on and it turned out that I could have done something different. All we hear is, I wish I had done, something more early on. So.
Good evening, everybody. So you've been listening into this press conference. Dallas County Judge Clay Jenkins. The big takeaway over the last half hour is the judge continues to talk. We'll continue to stream online at cbsdfw.com. But the big takeaway, restaurants will be closed, but only available for takeout. Bars, arcades, gyms, taverns, and movie theaters all be closing down in Dallas County.